Hi everyone, I'm presenting a case on a patient who came in with dizziness and the referring diagnosis was for vertigo. So I listed the structures here, contractile tissues that might refer or be involved in that area. This was the starting off point of hypotheses, pretty vast when it comes to things that can cause dizziness. I was going more towards unilateral peripheral vestibular disorder at first because we had a couple patients come in specifically with BPPV as the referring diagnosis. That's the only reason why one supersedes the other as primary. But other than that, knew that there was a whole slew of things I'd have to ask about and rule in or rule out with questions. So when asking about her symptoms, she has no pattern she can think of other than she's always awake. She hasn't woken up in the middle of the night with it. Sometimes closing her eyes will help when she's in the middle of an episode, and she is a former nurse and discontinued the use of her hypertension medications a couple months ago when they started, thinking it was a cardiopulmonary issue in her medications. She said this has helped decrease the nausea, but not the actual episodes. And that taking a Valium is the only thing that will decrease her symptoms as they are happening, or in the length of the episode. So they started 5 months ago, and her first episode lasted 10 hours. She was dizzy, and she describes her dizziness as just this not feeling right, like her head doesn't feel right, but she said there's no spinning. She's not spinning, the room's not spinning, things aren't moving. She doesn't feel right. She can't really see right, that blurred vision, and pretty violent vomiting her first episode, and couldn't walk well, like could not walk stably, very ataxic gait, sounded like the way she described it. And since then, she had another one after that about a month later, and since then they've been not as long in duration, but they've been increasing in frequency to about twice a week now, as opposed to a month apart. So going over her health history, she has coronary artery disease and has had 12 stents put in over the past 10 years. Cervical spondylosis, although she does not complain of any neck pain recently, that's just a diagnosis from a while ago. Arrhythmia started 1 month ago. She has angina, osteoporosis, and experienced one silent migraine about 15 years prior that resulted in her left eye. She couldn't see out of her left eye and created a hemiopsia. And all treatment for her symptoms right now have just been medication. So, again, medical history as far as review of systems so far, mostly the cardiopulmonary is the impaired one, just from the history. So based on that, I asked a whole slew of questions about red flags and to get a little closer understanding of what she was going through. So she denies all of those things listed and really only acknowledges that dizziness. I'm calling it dizziness, even though she describes it as this just not feeling right. She gets the nausea, vomiting, and blurred vision. Asking more specifically about double vision, or can you talk or swallow, she's like, during the episodes I'm vomiting so I can't swallow, but she hasn't noticed that more recently as her nausea and vomiting during the episodes has decreased. Like I said, she's a former nurse and not afraid of movement or serious pathology, trust in the medical system, and she denies any depression or stress in her life or as the cause of any onset of symptoms. When she had her second episode, she was on vacation and went to the emergency room. They thought she was having a stroke, so they had done a CAT scan of her cranium that, cleared brain bleeds and a stroke. She's been taking meclizine, which she says makes her really tired, and she prefers taking the Valium when an episode starts. I added this special question in. So prior, when asking her about patterns, she didn't really have anything, but when we were talking about health history and heart disease, blood pressure and whatnot, she had brought up that she can hear her pulse in her head. And I'd asked if she's sitting right now, she can hear it. It's like, well, no, I hear it sometimes, and then my heart will start to race, and that usually is when an attack will start or I start to get dizzy. And I asked if it's always in that order, and if that was kind of a warning sign for her that she was going to start. She said, "Yeah, I mean, it's I'll hear it in my head, and then heart races, and yeah, I guess that's usually when I know that I'm gonna start to get dizzy, so I prepare." She has told her cardiologist about this, and he had said that what I wrote there, because she's osteoporosis and her skull's thinning, she can hear them better, and he wasn't concerned about it. Thought that was interesting. So take a time out, go on Moodle, post any asterisks you can think of, the sins, and I'm going to be loading up a second video, audio video, for the rest of the exam. Thank you.